This guy was getting ready for a bodybuilding show, but instead of hitting the stage, he ended up in the ER, completely paralyzed. And across the hall, a woman prepping for her show was dying from the exact opposite problem. Meet MZ and TL. Both had trained for months, days away from their moment, but their bodies were shutting down, their hearts beating so wildly, doctors were amazed they were even alive. At first, they seemed like two separate medical emergencies. But what blood tests revealed connected them in a terrifying way, a deadly mystery rooted in their desperate attempt to achieve the perfect physique. By the time the medical team pieced it together, it was a race against the clock to stop their hearts from giving out. MZ was 28 years old. The paramedics found him in his shower, head between his knees, freezing cold water running. Just a day earlier, he'd called for an ambulance, convinced he was having a heart attack. His heart was racing, he felt like he'd black out, and he'd suddenly find himself unable to move. He had trouble swallowing, and yeah, he was throwing up stomach contents, violently, but he refused to go to the hospital. See, MZ was a bodybuilder deep into peak week for a competition, just days away. He figured he knew his body better than anyone. Hospitals meant IV fluids, and fluids meant ruining the dry, shredded look he'd worked 4 months for. He was sure he'd know if it was really a heart attack. Spoiler, he didn't. Across the hospital, 31-year-old TL was wheeled in. She was also prepping for a show, leaning out for her figure competition. She was having agonizing muscle cramps, vomiting, and her heart rhythm was all over the place. A day prior, she'd started feeling unwell. During her prep, she'd been taking a fat burner, not the kind you buy at the store. This stuff wasn't approved for humans in the US, but hey, her coach said it would make her anabolic and boost her metabolism. Her coach had told her, quote, "Do not stop taking it at any time during this cycle." His motto, "Coach makes freaks." And TL believed him. But very quickly, she couldn't do a lot of things. The cramps were non-stop. Her coach even doubled her cardio, and she literally collapsed because her blood sugar crashed. Now, in the hospital, doctors looked at both MZ and TL. Their hearts were beating so erratically, it was stunning they were still alive. Both were clearly dehydrated. You could tell just by looking at their skin, which didn't snap back like it should. Signs pointed to their kidneys starting to fail because there simply wasn't enough fluid flowing through. Then the blood tests came back. MZ had hyperkalemia. Hyper meaning high, kalemia meaning potassium in the blood. Too much potassium. TL had hypokalemia, hypo meaning low, too little potassium. Same scary symptoms, muscle problems, paralysis for him, cramps for her, chaotic hearts, extreme dehydration, but totally opposite potassium levels. What in the dehydration for a trophy world was going on? They were both intentionally dehydrating. This is called drying out, a common bodybuilding tactic to get that shrink-wrapped, super-defined look. You can't just vacuum the water out. Water levels in the body are tightly controlled by things called electrolytes, like sodium and potassium. Think of it this way. Water follows salt. Always. Your organs are constantly talking to each other using chemical messengers called hormones. This communication keeps everything balanced. But when you start injecting or taking things that mess with these hormones and electrolytes, you break the signal chain. And in the worst cases, that causes permanent, irreversible damage across multiple organ systems. Let's follow the trail starting with MZ. When you get dehydrated, your kidneys sense there isn't enough fluid. They kick off a complex chain reaction involving signals from your liver and lungs, ending with a powerful hormone called aldosterone. Aldosterone's job is to tell your kidneys, hold on to that water. It does this by making the kidneys grab sodium back from what would have been urine. Water follows the sodium back into your body, and you pee less. But here's the twist. Urine isn't electrically charged. When the kidneys pull positive sodium out, they have to push another positive ion into the urine to keep the balance. The easiest one readily available? Potassium. So the natural dehydration response driven by aldosterone actually makes you lose potassium in your pee. This should lead to hypokalemia. But MZ had hyperkalemia, too much potassium, the exact opposite of what the natural dehydration response aldosterone does. This told doctors he must have taken something that was blocking aldosterone, something that stopped his kidneys from flushing out potassium like they normally would during dehydration. The diagnosis dropped: spironolactone. It's a prescription diuretic, a water pill, often used for things like heart failure. But it has this side effect: it makes you hold on to potassium. MZ had basically given himself a chemical overdose of potassium by blocking his body's natural way of getting rid of it while simultaneously dehydrating. Now, back to TL, down the hall with her low potassium, hypokalemia. She was also taking a diuretic, but a different kind, hydrochlorothiazide, or HCTZ. This diuretic works on a different part of the kidney system. Instead of trying to save sodium like aldosterone does, HCTZ forces sodium out into the urine. And just like the previous scenario, where sodium goes, other stuff follows. In this case, potassium got dragged out with the sodium, flushing water and precious potassium out of her body. And that wasn't her only problem. Remember that fat burner acting like adrenaline? That was likely Clenbuterol. Adrenaline tells your body to shove potassium from your bloodstream into your muscle cells for quick energy. TL was already critically low on potassium from the HCTZ, and the Clenbuterol was essentially vacuuming the last bits out of her blood. Why does potassium matter so much? Your muscles, including your heart, use quick electrical changes involving sodium and potassium to contract and, critically, to relax. Potassium is the key signal for relaxation. MZ, with way too much potassium, had muscles that couldn't stop relaxing. That's why he was paralyzed. His heart was struggling because it was being told to relax, potentially forever. TL, with way too little potassium, had muscles that couldn't relax at all. That's why she had those constant agonizing cramps. Her heart couldn't relax properly either. Same goal, two different drugs, two opposite potassium levels, both leading straight to the emergency room with their bodies on the brink of collapse. Using powerful prescription medications designed for serious illnesses, not bodybuilding, to manipulate your body's ancient, fundamental systems comes with terrifying risks. Beyond the immediate, life-threatening potassium imbalances, both MZ and TL showed signs of irreversible long-term damage: enlarged hearts, kidneys starting to fail, hormone systems thrown completely out of whack. It's a strange paradox. Bodybuilders are meticulous about diet and exercise, healthier in many ways than the average person. Yet, they sometimes risk everything by using the very medicines designed for sick patients, chasing an extreme aesthetic. MZ and TL survived. They made a recovery. They're out of immediate danger of sudden death, but it's going to take a long, difficult time for their bodies to find some semblance of balance again, and they may live with permanent damage. So, next time you hear about the extremes of competition prep, remember MZ and TL. Messing with your body's core chemistry for looks is playing with fire. Ever heard a medical story this wild? Or maybe you learned something new about what potassium actually does? Let me know in the comments below.